Hi everyone, my name is Salome and I work as the research assistant on the unicorn study. So today I'll just be giving you an update on all the things we've been doing so far, mainly on three things, which is the COVID extension study that we did, the quality of life studies that we've done, and an update on the clinical data so far. Now, as many of you know, uveitis is a complex rare disorder, and oftentimes care for families involve different teams across different hospitals and specialities. This makes such families particularly vulnerable to disruptions in care. Now, seeing the major impact of the pandemic on the health service, we developed the extension project Unicorns C19. Using a questionnaire, we wanted to learn about the perspectives and experiences around the use of healthcare during the pandemic for children newly diagnosed with uveitis. Now, the questionnaire was a modified version of the Health Information COVID survey. There were 13 questions asking families about how the pandemic has affected their health and well-being, their experience of using the NHS service, and the view on how the NHS services are managing. Now, we received responses from 51 families, with many expressing a range of difficulties. Now, 61% expressed concerns over the impact of the pandemic on their health. 37% expressed difficulties in accessing essential medication, and 61% found it harder to get basic food items. Now, the majority described a positive experience with NHS services. 74% felt comfortable using their specialist hospitals for face-to-face appointments during the pandemic, and 57% felt comfortable using their local hospital for face-to-face appointments during the pandemic. Now, families reported positive experiences mainly around safety procedures in place at the hospitals and the adoption of most digital health tools. Families, however, also reported negative experiences around poor coordination of care and poor delivery of harmonized telemedicine care from their primary and secondary health teams, mainly GPs and ophthalmologists. And lastly, there were concerns around being on immunosuppression during the pandemic. Now, our findings suggest that the primary and secondary care teams need additional support when delivering care for families with rare disease, and better sharing of research among families with children on immunosuppressants to minimize their concerns. Well, when families were initially recruited into Unicorns, we sent them quality of life surveys. This is to really understand how uveitis affects their lives outside of the clinic, and we're going to be discussing those results, the results of the baseline ones today. The family background questionnaire is the first one, and this is to give us an idea of the families involved in the study, and it was completed by parents or guardians. We had 172 families respond. Now, 82% are natural mothers of the children involved in the study, and the most common parental age group at 49% is 41 to 50-year-olds, and 61% are of white ethnicity. Now, there are other questions around family structure, parental education, and home and car ownership, but we won't really be going into those today. The second one is the strength and difficulties questionnaire. So this was to screen the emotional and behavioral parts of the children's lives and how well families cope with things and children cope with things. It was completed by children over 10 and parents for children over 2. And we had 105 families respond. 44% of the parents with children aged 4 to 11 expressed concerns around how well their children would cope with things. And 44% of children aged 11 to 17 also expressed concerns around how well they cope with things. 56% of the families were not as concerned. The third one was the Child Health Utility Questionnaire. This assesses how children feel on an average day. It is completed by children over 7 and parents for children over 2. We had 98 families respond. So the scores are calculated to a sum of 0, which is your worst, it's worst feeling, and 1, which is feeling their best. Now, many of the families all seem to be in the middle to upper end of the scale, reporting that children on an average day feel good to great. Now, our fourth one was the child sleep habit questionnaire. Now, we all know the sleep can affect how children and families manage. So this questionnaire was to evaluate the frequency of behaviors linked with sleep difficulties. Now, it was completed by children over 10 and by parents for children over 2. We had 95 families respond, and 35% of them reported sleep-related problems, and 65% reported no sleep-related problems. And the last but not the least was general evaluation. This questionnaire was to assess the overall well-being of the child and considering all the ways uveitis impacts them, from the perspective of the child as well as the parent's perspective. Now, this was done on the line with a scale of 0 being very well and 102 very poor. We had 126 families respond, and on average, both the parent and child had reported a similar perspective. But children reported around 5% higher in comparison. So if the child reported 20, parent reported 25. Now onto the clinical update. We're still in the process of collecting clinical data, and as many of you know, it has been challenging to get things up and running because of the pandemic, so we had some unexpected delays. But so far, we've been able to visit and collect data for 45 patients from 10 hospitals. 74% of those patients have anterior uveitis. 58 instances of systemic medication like methotrexate, epinephrine have been prescribed, and 30% of the patient referrals came from optometrists, with A&E as a close second at 25%. Thank you so much for listening, and I want to thank our funders and collaborators, and especially the Unicorns families for taking part. So if you have any questions, I'm happy to answer them.
Thank you so much, Salome. So Salome started her first job following her degree with Unicorns during the pandemic. So Unicorns was supposed to start in April 2020. Other things are happening in the UK in the early 2020. So it's been an incredibly hard journey to get the study up and running. And as well as thanks to all the families who've helped, we also really have to thank Salome for getting it up and running. Thank you so much for presenting that. To put those two things together, so first work that she presented on what had been the experience of families whose child been diagnosed uveitis in that first bit of 2020 when the world had gone crazy. And even though we may never live through a COVID pandemic again, we have coming storms. We have the cost of living crisis, and we also have the NHS crisis well ahead. So to be able to describe what happened in a good way and what happened in a bad way, so we can tease out, well, the centres that did well, what were they doing differently from the centres who didn't, and to be able to share that learning across networks, that's really powerful. So again, thank you so much to everyone in the room and everyone online who contributed to that. Let me stop the share. And then the second thing, so the quality of life metrics. Many of the studies that look at childhood uveitis and what happens uveitis tend to, that's my picture in the background, tend to focus on what the eyes look like, what the vision is like, whether or not they're on lots of treatments or not. And we felt it really important to make sure that we got down to, well, what's the family actually going through? And there are lots of questionnaires that we ask you to complete, both, you know, when you're at home, and also people who are doing it through the years as the Unicorns will go on. And we think that's really important, be able to track how your family's doing over the years and be able to tease out what are the various things that might impact on that. And because it's also complex, as you can imagine, it's so complex explaining why you feel a certain way on a given day, let alone over the course of your lifetime. That's why we're asking you to do all those questionnaires when they come through in the post. We can get that information we need to tease out why some families are doing really well, even though the uveitis might be doing quite badly, and when some families are really struggling, even though the uveitis on paper seems to be doing really well. So thank you again. And I think we now have some Q's and A's from the audience to have a look at, and I'll get them up unless people have got, there we go. That's a really good point. Okay. The chat is saying it's disabled online. I'm going to answer that live. So the chat is disabled online, but for those of you online, you can put any questions you have into the Q&A so that we can answer them and it might spark a conversation in the audience as well. And there's another information. So it might have been great to see this info when we started treatment, or would it have been overwhelming at the time? That's a really, really good question. That's one of the reasons why we came up with the videos, or I asked the families their help in coming up with the videos, because it seemed like a really useful way to have an introduction to uveitis and uveitis treatment that wasn't overly overwhelming. And of course, it's got links within that to more information for those people who feel ready to answer those questions. But I mean, some families, I think, are overwhelmed if we give them too much information at the beginning, but it's always our job to tease that out family by family. How much do you want to know right now? We could tell you everything, or we could tell you bit by bit and get you ready for each stage. But thank you so much to whoever that attendee was for asking that question.